FNA sampling procedure. When you prepare to take care of a patient and do a fine needle biopsy, make sure that you are positioned optimally with the patient. Make sure that the patient is close enough to your side of the table so you don't have to lean over too much. If you have an adjustable table, make sure that you have the optimal height for the patient so that you don't have to move your elbows out too much or to lift your shoulders during the procedure. Then position your fingers on any palpable nodule with your elbow as close as possible to your body, and also try to have a position with your sampling needle that allows you to have a relaxed position of the arm. If the arm is too far out, you will be very quickly tired, and it's more difficult to control the needle and do a effective sampling. You also do not want to use an angle with your wrist in an extreme position. Try to keep it as neutral as possible in your position as you prepare to do the biopsy. Place the needle at the proximal aspect of the target with a needle tip at the edge of, or just barely inside the target. Plan to tailor the excursions of the needle tip to the length of the target diameter, unless the target is very large. Place the needle such that you are aiming toward the center of the mass. This will provide the best chance for optimal material. Necrosis is fairly rare, particularly in small to medium-sized targets, and by moving the needle forward throughout the entire target area, any necrotic material will be mixed with sufficient diagnostic, well-preserved material in the vast majority of cases. If the initial sample shows only or very extensive necrotic debris, the second sample can be planned for a different part of the lesion. However, if the needle tip is placed for sampling tangentially, just barely inside the edge of the target, the harvest in most cases will be less abundant and often insufficient for diagnosis, and any additional testing needed. Move the needle with a tip placed well within the target, forward with a purposeful motion, imagining that you are carving small tissue fragments from the lesion. After the forward motion, pull back the needle to the original position and repeat the forward motion for additional sampling. If there is no evidence of blood or tissue appearing at the hub of the needle or the tip of the syringe, then make 15 to 20 excursions at about this pace. A purposeful carving motion is more effective than a quick stabbing motion. If blood or biopsy material is starting to appear after about 10 excursions, stop the sampling and release any suction before retracting the needle and prepare the sample for rows, additional smears, or triage as appropriate. If blood is showing at the hub instantly or very soon after sampling is initiated, then do 5 excursions before concluding sampling. Lack of needle excursions through the target area, with or without applied suction, almost always result in insufficient material. The only exception is an entirely cystic lesion where suction alone will evacuate the cyst fluid. Rotating the needle does not improve the harvest. Make sure the needle is moving through the target by making purposeful forward motions. You should have the sense that the needle tip is carving small fragments of tissue that are collecting inside the needle shaft. Jiggling the needle is not effective. If using ultrasound to guide the needle, watch the needle tip during sampling to ensure the needle is within the target and there is optimal range of sampling. For small targets, aim the needle toward the center of the mass and sample in a single plane. The goal is to keep the needle in optimal position inside the target and tailor the excursion to the size of the mass. Changing of needle direction in the hopes that the needle will hit the target at least part of the time is less effective and will often result in very limited or no diagnostic material at all. In larger targets over about 3 centimeters, changing directions may be helpful. However, remember to first sample one area, then pull out the needle to position the needle tip at the proximal end of the target before pushing forward to sample another part of the mass. Avoid creating tension on the needle while sampling. This is the result of tension in the hand and/or the arm, which results in upward pressure on the syringe and the needle complex. Instead, relax enough to allow the needle to feel like it is resting slightly in the tissue without putting excessive pressure downward. Working with a needle bent by tension may cause injury should the needle slip out.